Hello everyone. First and foremost, I want to wish you all a wonderful day. I'm glad you're joining me on my channel. Today, we're going to explore the 6 symptoms of heart attack 1 month before that you should never ignore. I know you are busy with your daily routine, so don't worry, I did a short intro, summarizing the whole video as short and informatively as I could. So without further delay, let's get started. Symptom number 1, chest pain or discomfort. This pain is often described as a feeling of pressure, squeezing, or fullness in the center of the chest. It may feel like an elephant is sitting on your chest, making it difficult to breathe. Symptom number 2, shortness of breath. This occurs because, during a heart attack, the heart muscle is not receiving enough oxygen-rich blood, which can lead to a feeling of breathlessness or gasping for air. Symptom number 3, pain or discomfort in other areas. Pain or discomfort can occur during a heart attack in the arms, particularly the left arm or both arms. This pain may feel like a dull ache, tingling, or numbness, radiating from the chest down to the arms. Jaw pain or discomfort is another potential symptom of a heart attack that is often overlooked. Symptom number 4, nausea or vomiting. They are typically associated with stomach illnesses or food poisoning. Additionally, the intense pain and stress associated with a heart attack can trigger the body's natural reflex to vomit. Symptom number 5, sweating or clammy skin. This surge of adrenaline can cause the sweat glands to become overactive, resulting in profuse sweating, even in cool temperatures or at rest. If you find yourself drenched in sweat without any apparent reason or physical exertion, and this symptom is accompanied by other potential heart attack signs like chest pain or shortness of breath, it's a cause for immediate concern. Symptom number 6, fatigue or lightheadedness. This fatigue can be sudden and debilitating, leaving you feeling as though you've run a marathon despite being at rest. This symptom may manifest as a feeling of imbalance, vertigo, or even a brief loss of consciousness in some cases. Now, if you're looking for more understanding of heart attack symptoms, let's dive deeply. Every year, hundreds of thousands of people lose their lives to heart disease, the silent killer that often strikes without warning. Symptoms can occur months or even longer before a heart attack occurs. But what if I told you that many of these deaths could have been prevented by simply recognizing the warning signs? In this video, we're going to uncover the 6 most common symptoms of a heart attack that you should never ignore. Heart disease is a leading cause of death worldwide, claiming millions of lives annually. In the United States, a heart attack occurs approximately every 40 seconds. The tragedy is that many of these heart attacks could have been avoided or treated more effectively if the symptoms were recognized early. A resting pulse rate of 120 beats per minute in adults would be considered high, while a heart rate between 60 beats per minute and 100 beats per minute is normal for people 15 years older and adults including seniors. So, whether you're watching for yourself, or a loved one, or simply to educate others, pay close attention. This information could prove invaluable in the face of one of life's most critical emergencies. Symptom number 1, chest pain or discomfort. The most well-known and classic symptom of a heart attack is chest pain or discomfort. This pain is often described as a feeling of pressure, squeezing, or fullness in the center of the chest. It may feel like an elephant is sitting on your chest, making it difficult to breathe. However, it's important to understand that chest pain during a heart attack should never be ignored or downplayed, even if it seems mild or intermittent. Many people make the mistake of dismissing chest discomfort as indigestion or muscle strain, only to realize too late that they are experiencing a life-threatening event. It's also important to note that chest pain during a heart attack can present differently for different people. While some may experience a classic, crushing chest pain, others may feel a more subtle discomfort or even just a mild ache or tightness. Atypical chest pain can be especially common in women, the elderly, and those with diabetes. Typical chest pain during a heart attack is often described as a heavy, squeezing sensation in the center or left side of the chest. It could spread to the arms, shoulders, neck, jaw, or back. A typical chest pain, on the other hand, can be more diffuse, fleeting, or even mistaken for heartburn or indigestion. Regardless of the intensity or nature of the chest pain, it's crucial to err on the side of caution. If you or someone you know experiences any form of unexplained chest discomfort, especially accompanied by other symptoms like shortness of breath or nausea, it's essential to seek immediate medical attention. It's crucial to err on the side of caution. If you or someone you know experiences any form of unexplained chest discomfort. Symptom number 2, shortness of breath. Another common and concerning symptom of a heart attack is shortness of breath or difficulty breathing. This occurs because, during a heart attack, the heart muscle is not receiving enough oxygen-rich blood, which can lead to a feeling of breathlessness or gasping for air. It's important to note that shortness of breath can be a normal occurrence during physical activity or in certain medical conditions like asthma or chronic obstructive pulmonary disease, COPD. However, when it comes on suddenly, unexpectedly, and is accompanied by other symptoms like chest pain or dizziness, it could be a sign of a heart attack. Unlike the typical shortness of breath experienced during exercise or physical exertion, the breathlessness associated with a heart attack often comes on without any apparent cause or trigger. It may feel like you can't catch your breath, even while sitting or resting. This sudden, unexplained difficulty breathing should be taken seriously and prompt immediate medical attention. In some cases, shortness of breath may even be the only symptom of a heart attack, especially in women and older adults. This is known as a silent heart attack, where classic chest pain is absent, making it even more crucial to recognize this potentially life-threatening symptom. If you or someone you know experiences sudden, unexplained shortness of breath, particularly in combination with other symptoms like chest discomfort, nausea, or dizziness, don't hesitate to call emergency services immediately. Prompt treatment is essential to prevent further damage to the heart muscle and potentially save a life. Symptom number 3, pain or discomfort in other areas. While chest pain is the most well-known symptom of a heart attack, the discomfort can also manifest in other areas of the body. It's important to be aware of these less obvious signs, as they may be the only warning you receive. One common area where pain or discomfort can occur during a heart attack is the arms, particularly the left arm or both arms. This pain may feel like a dull ache, tingling, or numbness, radiating from the chest down to the arms. Back pain, especially between the shoulder blades, can also be a sign of a heart attack. This discomfort may be mistaken for a strained muscle or a pulled back muscle, but if it comes on suddenly and is accompanied by other symptoms, it's crucial to seek medical attention. Jaw pain or discomfort is another potential symptom of a heart attack that is often overlooked. The pain may feel like a dull ache or tightness in the jaw, potentially radiating to the neck or shoulder area. Stomach discomfort or indigestion-like symptoms can also be a warning sign of a heart attack, particularly in women. This discomfort may feel like a knot or pressure in the stomach area, accompanied by nausea or vomiting. It's important to note that these areas of discomfort may occur with or without chest pain during a heart attack. If you experience any unexplained pain or discomfort in your arms, back, jaw, or stomach, especially in combination with other symptoms like shortness of breath or sweating, don't hesitate to seek immediate medical attention. Recognizing these less obvious signs of a heart attack can be crucial, as they may be the only warning you receive before a potentially life-threatening event occurs. Trust your instincts and err on the side of caution. It's better to be safe than sorry when it comes to your heart health. Symptom number 4, nausea or vomiting. Nausea or vomiting are often overlooked as potential signs of a heart attack, as they are typically associated with stomach illnesses or food poisoning. However, it's crucial to understand that these symptoms can also be indicators of a life-threatening cardiac event. During a heart attack, the reduced blood flow to the heart muscle can cause a buildup of waste products in the body, leading to feelings of nausea or vomiting. Additionally, the intense pain and stress associated with a heart attack can trigger the body's natural reflex to vomit. It's important not to dismiss nausea or vomiting as just a stomach bug or something you ate, especially if these symptoms are accompanied by other warning signs like chest pain, shortness of breath, or arm discomfort. Failing to recognize nausea and vomiting as potential heart attack symptoms can delay crucial medical treatment and increase the risk of severe complications or even death. If you or someone you know experiences sudden, unexplained nausea or vomiting, particularly in combination with other heart attack symptoms, it's essential to seek immediate medical attention. Don't make the mistake of assuming it's a minor stomach issue. The consequences could be devastating. Remember, nausea and vomiting are not always present during a heart attack, but when they do occur, they should be taken seriously as potential warning signs. Trust your instincts and don't hesitate to call emergency services if you suspect a heart attack is occurring. Prompt treatment could make all the difference in preventing further damage to the heart muscle and potentially saving a life. Symptom number 5, sweating or clammy skin. Another potential warning sign of a heart attack that often goes unrecognized is excessive sweating or the development of clammy, cold skin. This symptom may seem unrelated to heart health, but it can be a crucial indicator of a life-threatening cardiac event. During a heart attack, the body's natural stress response is triggered, leading to an increase in adrenaline production. This surge of adrenaline can cause the sweat glands to become overactive, resulting in profuse sweating, even in cool temperatures or at rest. However, it's essential to differentiate between normal sweating, such as during exercise or in hot conditions, and the excessive, unexplained sweating that can accompany a heart attack. If you find yourself drenched in sweat without any apparent reason or physical exertion, and this symptom is accompanied by other potential heart attack signs like chest pain or shortness of breath, it's a cause for immediate concern. Clammy or cold skin can also be a sign of a heart attack, as the body's blood flow is redirected away from the extremities and towards the vital organs during a cardiac event. If you or someone you know experiences sudden, unexplained sweating or clammy skin, particularly in combination with other heart attack symptoms, don't hesitate to seek emergency medical attention. It's important to note that sweating and clammy skin alone may not necessarily indicate a heart attack, but when combined with other warning signs, they can be crucial indicators of a potentially life-threatening situation. Symptom number 6, fatigue or lightheadedness. The final warning sign of a heart attack that should never be ignored is sudden, extreme fatigue or lightheadedness. While feeling tired or dizzy can be attributed to various factors, such as lack of sleep or dehydration, it's crucial to recognize when these symptoms may be signaling a more serious underlying issue. During a heart attack, the heart muscle is not receiving enough oxygenated blood, which can lead to a feeling of overwhelming fatigue or exhaustion. This fatigue can be sudden and debilitating, leaving you feeling as though you've run a marathon despite being at rest. Lightheadedness or dizziness can also occur during a heart attack, as the reduced blood flow to the brain can cause a temporary disruption in oxygen supply. This symptom may manifest as a feeling of imbalance, vertigo, or even a brief loss of consciousness in some cases. For women, heart attack symptoms can sometimes present differently than in men. Instead of the classic chest pain, women may experience more subtle symptoms like fatigue, nausea, or back pain. It's crucial for women to be aware of these atypical signs and not dismiss them as minor or unrelated to heart health. Elderly individuals and those with diabetes are also at an increased risk of experiencing silent or atypical heart attack symptoms. Due to various factors, such as nerve damage or reduced pain perception, they may not experience the intense chest pain typically associated with a heart attack. Instead, they may report more generalized discomfort, shortness of breath, or extreme fatigue. Delaying treatment during a heart attack can have devastating consequences, as the longer the heart muscle is deprived of oxygen-rich blood, the greater the risk of permanent damage or even death. By recognizing the warning signs and acting quickly, you increase your chances of survival and minimize the long-term effects of a heart attack. Thanks for watching. If you found this video helpful, don't forget to subscribe for more helpful healthy tips.